Okay, hi everyone. Looks like we are not gonna be able to share a lot here in Top Aesthetics Official as they are blocking partially for some reason, but we are in YouTube, we are in Magic Surgeon, and we are here in Facebook Live as well, so we are covered here. We're gonna be answering some questions as usual on Tuesdays. Hola desde Chicago. Hola Mari. Let's see where people is coming from. Tomorrow we're gonna do some more Spanish. So, Harry, how are you? We're gonna do miércoles en español. So for those of you that continue to follow me on Snapchat as well, we're gonna be doing snaps in Spanish tomorrow. From Nigeria, Five Skin Doc. Good to have him. We have Atlanta, Connecticut, Houston, California. Oh my God, Mississippi. This is amazing. This is North Carolina. Karim, who is Harry Guns from Canada. How to our Canadian friends from the hotel. Where's real high from the hotel? Schedule for tomorrow. That's awesome. We're looking forward to seeing you tomorrow. That's amazing. Katie is going back to Buffalo. That's awesome. Back to the cold. Hopefully it's not too cold anymore. Hi, Ceci.
Hi everybody, what's going on? I have really good news today.
If
you guys purchase one item, check this out. Scoot it a little bit. Sorry you're having your coffee, but this is a very important conversation.
Okay.
That if you purchase one item in an online store, topaesthetics.com, you go to the right, it says store, you click there, you purchase one item.
Oh, they have a store now.
We have a store. Listen to this. If 10 people purchase one item each, he's giving me a free BBL.
Says who?
A free BBL. Says me.
Says
I'm so
who?
promoting myself. Listen, look at this. I'm not kidding you.
If you guys like, I don't know if you can all see, but if not, then just check the store. It's actually pretty nice. You can see some of the cool merchandise, but also, fajas and all that. If you need anything, just put your order, even if you're at the hotel.
I mean, look how cool this is. I'm not that big. This is like a large size, but look how awesome this is.
That is a nice hoodie.
And it's all very minimalistic. So if you like that style, which we adore it here, and you're proud of your doctor and you want to support me with my BBL and my nose job, just go ahead. Topaesthetics.com. You click where it says store. For 10 purchases right away, I get a free BBL. It's on you.
Nose job is gonna take like 100.
Are we locked in Top Aesthetics? I can't see you over there.
We are actually we are banned from Top Aesthetics. I think you were.
Yeah, they're restricted. All right.
Ceci has been posted inappropriate things.
Yeah,
looks like
I'm
it.
sorry.
So I'm sorry. I was told that the pre-treatment with Kuo can help break out fibrosis from the previous liposuction. Would you agree? That's a good question. So Kuo is actually an enzyme derived from the family of the Clostridium bacteria, similar kind of the Botox, from the Clostridium bacteria. But that substance, what allows to do is to break some of the fibrosis, and they use it for the treatment of cellulite. That's how they do it. In terms of I'm sure it's something that could be tried in terms of the off-label use of Kuo for the breaking off of the fibrosis. I have not really, I don't think there is yet some scientific studies that have proven this to be the case, but I don't think it will hurt to try. At least you can try in a small area, similar to the treatment that they do for cellulite. So it does work on cellulite. Now remember, Kuo, that treatment for cellulite, leaves behind a pretty extensive area of ecchymosis or bruising. So it will work, but then you're gonna have to go through the bruising period that could last a few weeks, just to be mindful about that. But it seems to be working for fibrosis. For cellulite, so it could work for fibrosis as well. So that's a good actually question. I would be willing to try. We don't do Kuo here at the office, but we might start doing something like that, and I wouldn't mind to try it. If you are on blood pressure medication, can you still get a BBL or lipo? So great questions. If your blood pressure is under control, sure, you should be like just like a normal person. Same thing for diabetics. If your blood sugars are under control with your insulin or your medications, then fine. Yeah, you should be no problems. So yes, the answer is yes, you should. How long until I can put my scar cream on an extended tummy tuck? Usually 1 month. You want your incisions to be completely healed. There's no openings and no scabs in it and all that. So usually about a month, I would recommend. It's usually the time frame that it takes to start using the scar cream. And you can also do silicone sheetings or those little band-aids of silicone. What's the time in America here? Time is 5 o'clock. We do this at 5 every Tuesday. So 5 o'clock, now it's like 5:07. Let's see, we're gonna get back to lifting things after an extended tummy tuck. So you should not probably lift anything heavier than 10 pounds for a period of 6 weeks. So after 6 weeks, you can return to, light exercise, and you can slowly progress into a normal routine. I would say for sure, after 6 months, you should be able to do everything you were doing before. But for the first 6 weeks, make sure you take it easy. Surgeries in 20 days, and I'm extremely nervous. That's okay. That's normal. You'll be more nervous the day before your surgery, so don't worry about it. The good thing is that I am not nervous, so that's important. And definitely, I understand that it takes a lot of guts and courage from the female side or guy side, like if you are a guy coming for plastic surgery, to go through this. But with us, there's a lot less to worry about because we have a lot of things figured out for you. And this is one of the things that I want to stress out today. Remember that one of the things we strive in our practice is to keep the highest standards for safety. And for that reason, we have prepared the whole package for you, so you don't have to worry about where you're going after surgery, who's taking care of you, who's doing your massages, and all these things that could be pretty stressful on top of the stress of surgery. So, you're not gonna find similar treatments for this price and for this level of service and safety. So, 100%, if you're coming with us, you should be great. Let's see. Hi, Dora. If I get a tummy tuck before having children, would I need to get a C-section? The tummy tuck has nothing to do with you needing or not a C-section in the future if you have babies after a tummy tuck, actually. So they probably not necessarily. You will undo your pregnancies will undo some of the repair of the muscles that we do with the tummy tuck for those patients that have tummy tucks before before the end of having children. So if they have children after the tummy tucks, there might be some of the muscle repair that will get undone. But I always say, if you're not sure if you're gonna have more kids or not, you're gonna look better after the tummy tuck, even if you have a children after, if you have a pregnancy after, than what you would if you get pregnant and you hadn't had a tummy tuck before, you see? So I think you're still gonna look good, and usually it will be unlikely that you need another one.
All right, it's my turn.
What's up?
I'm not going to talk about the BBL for a while. I'll let you guys think about that one and the nose job. So you guys are talking about the consultation about finance. I know a little bit about that. You're asking if we finance this. We do have a great plan. If you don't have the money cash, if you don't have a credit card, you can always apply for care credit. You have 2 years to pay it off, but the first year there's no interest in your payments. So it's like almost free money that they're giving you for a year. The cool thing about our practice is that if you book with us, you only have to put $500 down. They're non-refundable, but they go towards your surgery. Like for example, Exparel, which is $500, which I strongly recommend. So you have a full year to get the surgery. So for a full year, you don't have to worry until, is it 21 days prior to the surgery that you have
Correct.
to pay it in full? So only 21 days prior to your surgery is that you paid and you start the payments and everything there. So if you find that you see really great prices, which we do have for the exceptional work that we do, lock the deals, because you know, you guys, there's a lot of inflation. Did you see how much gasoline is? And we still are keeping our prices super low. We have Care Credit, we have Alfian. Check on our website. It says financial options.
Yeah.
Click there, you can see it. No interest in the first year. And if you have doubts, DM us and we always respond.
Yeah, our coordinators can tell you a lot about the payment plans and so forth. You know, some patients, what they do is they put the initial deposit to lock a price or a date, and then, you know, they have a full year to make the full payment. So sometimes they make payments, let's say that they pay the first $2,000 throughout the first 6 months or 8 months, and then they finance the rest. And if you get a good financing rate through our companies, you can do 1 year, I believe, is without interest. And then if you do 2 years or 5 years, you know, you can check with them in terms of the interest. And I think it's another great way of doing it. So that's great. And check our website in the financing section. You can actually go straight, for example, into Care Credit, and it goes to our Care Credit site. And then you can actually put how much you want to finance, and it will split out the payments for you. It will tell you exactly how much it's going to cost you every month for however, you know, month you want to make it. Let's see. I'm going to try to get as many questions as possible. Is the board necessary, and if so, for how long? The board, when we do only liposuction, it's recommended in order to avoid those falls that form when you sit. So the board will keep you straight, you know, and you should wear it for about a month or 6 weeks if possible. You can wear the foam on top of your foams. Where do I wear the stage 2 faja? When the stage 1 starts getting loose. How soon can fibrosis form? You will start having fibrosis. The formation of fibrosis happens usually starting the 2nd or 3rd week. You're gonna notice that there are areas that are harder, then eventually become softer, but some might not, you know, so massages help a lot prevent that and work through that. You don't want a lot of fluid accumulation, so the massages help move all that fluid and get your lymphatics to remove all that excess fluid, which could end up being in fibrosis later. Thoughts on Sculptra for small dimple after skinny BBLs? Sculptra is a filler that you could use it for these small dimplings, but it could be very expensive. So I would probably check with if those dimples are mostly related to cellulite, you might be better with Cool, what we mentioned at the beginning, or even Selfina. Selfina is another treatment for cellulite that might work for those areas of dimples, more so than filling them up. Why do you ask so many labs for surgery? Well, because we are actually safe. If they don't ask you for these many labs, they might be forgetting some stuff. And actually, it's not that bad. I mean, it's pretty routine what we ask for. So if they're asking you less than this, maybe they're only asking you enough.
Okay, I have something to say about that. We had a lot of situations with this, and I want to explain because you just asked that question. When is the last day that I can smoke or drink alcohol before surgery? Guys, listen, if you have to reschedule a surgery, it's $1,500. Now, I don't know if that means a lot to you. For me, it's a trip to Europe, around one. And because I always do bargain, I actually pay everything, the cost of the ticket and the stay. So you do not want to smoke or drink 1 month before your surgery. And I know it's a little bit exaggerated. We do this on purpose.
Drink what?
Like vodka, like drink alcohol like Cosmopolitans and smoke a cigarette.
That's a little extreme. But smoking? No,
they told me a month to be safe.
Okay, yeah, well, forever. Listen, you definitely, you know, we want to try smoking. I mean, smoking will prevent you from having surgery 100% if smoking nicotine. If nicotine is in your body, the same thing with some drugs, I would tell you not to do it, you know. So a lot of patients that we have are on weight loss medications. That weight loss medications sometimes have phentermine or other additives that will interfere with the medications we give you for anesthesia. So you can't have that either. So it's important that you stop taking these medications 30 days before, as well as nicotine. When it comes to alcohol, you know, it will make you bleed a little bit more, but the alcohol, it goes away of your body pretty quickly. So actually, I would recommend perhaps to stay away for at least a week, just to you prepare your body to a healthy recovery. The same thing goes for the other things that you have to stop. But I would say it's okay to stop alcohol about a week, and definitely all the drugs that you should not be doing, like weight loss medications, some prescription drugs that you should we have to stop before too. So just check with us. We'll let you know, but no smoking, please. Let's see. How long do I have to sit on my butt after a BBL? So I have to not to sit on my butt, I guess. How long do I have not to sit? So we'll give you a BBL pillow that you can use for the first 3 weeks. After that, you can do whatever you want. How long do I have to stop smoking? Again, I just told you that, 1 month. Hookah or anything, like no vaping, no smoking, no hookah, no marijuana, nothing. My recommendation is for 1 month before and 1 month after, don't do any smoking of any kind. Can you do a breast augmentations with the lift and 360 lipo, and what's the recovery time? Yes, we do that a lot. The recovery time is about 2 weeks, mainly for the liposuction stuff and not so much for the breast. From the breast, we will recover pretty quickly. Let's see if there's somebody here that wants to join. Let's see if Steph wants to join. Do you do an internal consult in every tummy tuck? Yes, every tummy tuck gets an internal corset. Hello, Steph, are you there? Oh, she left. So every tummy tuck gets an internal corset except for the mini tummy tucks, but all the other ones do get an internal corset. So if you're a patient around there, I want to share your amazing results, please do. We're happy to say, and if you're a prospective patient or a patient that is thinking of having surgery, is going to have surgery soon, and you have questions, jump in. I'm sure your questions will help a lot of other people. Let's see. If you haven't had kids and you get a tummy tuck, is the muscle repair required? Probably yes. The muscle repair will always help, I think. And if you have also lost, you might never had kids, but you might have lost a lot of weight. Well, the weight had probably behaved like the pregnancy. So it definitely will help to get things tightened up. So we always do a muscle repair in tummy tucks, regardless of you having kids or not. Hello.
Hi, doctor. How are you?
Good. How are you?
I'm good. I'm waiting for your call. Do you know who I am?
Tell me.
I came from Boston, and you wasn't able to see me.
Oh my God.
I was a patient.
I know who you are.
Yes. Can you please call me when you have a chance, because I want to book my surgery.
Very good. Let's do it. Actually, can you send us a DM once you are not driving anymore?
Yes, I will. I'm sorry. I was like, I gotta get his attention.
That's okay. Send us a DM and I'll
Send us a DM and I'll respond to you right away,
Yeah.
like this. We apologize.
I will call you tomorrow.
Okay, I will. Thank you.
Be safe.
Thank you.
You're very welcome. Adios.
Bye.
Adios.
Bye.
So if you guys have any questions, you can always jump in right here and we'll ask you, or we'll answer all your questions. And we might ask you some questions too. Let's see, Harry Guinness. So 6 months before lifting 50 pounds on extended tummy tuck. Yeah, definitely 6 months for 50 pounds. Hello. Hi, Harry.
Hello.
How are you?
Good, thanks. How are you?
Pretty good.
So I am from Canada, Calgary,
Awesome.
and I booked surgery, breast augmentation, and lift, and 360. And BBL.
Yeah, perfect.
So I've prepared everything. However, the one thing that is still stopping me from booking the flight, which I'm a little bit late,
Okay.
is because here in Canada they do not provide nicotine tests separately.
Okay. That's
And
okay. That's okay. So we always recommend that, okay, to do it before. If you, for any reason you cannot, as long as you're sure that you did not use nicotine or you consume nicotine, we will test you the day of your surgery here for nicotine. If you're negative, then you don't have to worry about it.
Yeah.
For the people that smokes, then we always recommend for them to do it before, just to make sure that it's out of their system, at least within 2 to 3 weeks before. But if you couldn't do it before, that will not prevent you from doing it, as long as you're negative when you come here.
Yeah, and I did, when I filled out my medical form, I did put there as yes, because I did do before herbal hookah,
Very
but because it included in the question hookahs and tobacco, and that's why I was forced to kind of put yes there. However, under the drug panel, which they do here in Canada, if you smoke, in the nicotine will show as, for example, caffeine, nicotine, and etc. So I've been going back and forth with doctors and labs here, and they're like, we can't do anything. This is how we do it.
Well,
so
I think if you have not really smoked, like we told you, for about 30 days, you shouldn't. There's nothing for you to worry about. A lot of times we do add the hookah or these other modalities because sometimes the patients they think smoking and they only think about cigarettes, but they don't realize that sometimes they go to a party the day like a week before or a few days before the surgery and they're smoking hookah and they smoke hookah and they didn't think about that may have nicotine on it. So we always make that distinction also for vapes or things like that, so the patients remember that nicotine could be in those things as well. So that's the main reason why we mention those other modalities, so that people don't get back here and say, oh my God, I remember I didn't smoke cigarettes, but I got hookah with my friend last week. Anyway, so those are the things, but I appreciate it, and I understand that sometimes in patients that come from other countries too, and they don't do this routinely, so it's okay. As long as you behave, then you should have no problems.
Sounds good.
Yeah,
Okay.
well, we're looking forward to seeing you soon.
Looking forward to it.
Thank you. Thanks a lot.
Bye.
Yeah, I think these things are important, and this clarification helps a lot to other ones, other people. Some of the questions that I've seen here, for smoking weed and doing this, our advice is always don't do it for 30 days and you'll be safe. We can tell you sometimes we're not gonna just cancel your surgery because you have THC in your system or so, but sometimes those things can mix with nicotine and you don't realize, and your nicotine will be positive and then you will get canceled. So to avoid that, it's better to stay away from it. Let's see.
Somebody showing.
My question.
Can I respond to something, Doc?
Sure.
So guys, listen up. You have a question about Exparel. Can you talk a little bit about Exparel? Listen, for one thing, we don't make any profit with Exparel. It's only for you and for your own good. Exparel is a local anesthesia, and it is amazing because for 2 days, you don't feel any pain. I mean, there's like the worst thing that could happen to you is wake up from the surgery and feel pain. Well, that's all gone. It even fixes a broken heart. I always say this. Exparel is the magical drug and it's local, so it doesn't give you that nausea feeling. Because when I got surgery, I got really nauseous back in the days when they did this beautiful nose job. I'm just kidding, but get Exparel. I mean, there's no price for feeling great when you wake up with the surgery. For 2 days, you just feel the discomfort, but you don't feel the pain. And we don't make any profit. Again, we're not selling anything here. We do it for your own good.
Yeah, it is important. I think it's a good medication that helps a lot decrease, obviously, the pain, but decrease the amount of pain medicine you will take after it, which will not make you feel really good. So it's important, especially if you're having a tummy tuck. It works for every surgery, but surgeries that cause more pain, it's a little bit better to use it. How long? Let's see here. More. Is your tummy tuck BMI 32 max or 30? Okay, BMI and tummy tucks, it's very variable. We have a general set at 32, but some patients need to be on a much lower than that, like 27, and some patients could be a little bit over that and will still be a candidate depending on the fat distribution in your abdomen. So if your fat is not all in your tummy, then maybe a higher BMI, it's okay. But if your fat is all in your tummy, maybe you have to go into BMI of like 27 or 25, you know. So check with us. The best thing is just send us your information, send a free consultation, so you can send that free. We will look at it, we will make the best plan for you. I will look, see your pictures, see, and then give you my advice if you're okay for a BMI that you are or not. Do you do natural breast augmentations with your own body fat? Well, I guess you can only do natural breast augmentations with your own body fat. If you're talking about fat transfer to the breast, you can only augment the breast like 50 to 100 cc's, which is very little. So I'm sure that's very natural. So to put it otherwise, you cannot be unnatural doing fat transfer, but you might not be very happy if you're expecting a higher volume, you know. So I don't believe fat transfer to the breast is a great first step for breast augmentation. I do believe implants are much better, give you better shape. You know, you usually can increase the volume much more if you need to, and we can still make you look natural with implants. So think about that. Thank you for your question. I think allows for clarification in this issue. My stage 1 faja is big, but stage 2 is really tight on my butt. So that's a good question. So you have a waist trainer. If you had surgery with us, you received also waist trainers. So when your faja starts getting loose and you have your foams in it, you can put your waist trainer for a while until, you know, things improve. So that way you don't have to have a super tight stage 2 faja around your booty. Good question. Do the body, the waist trainer, that corset that will give you, and you will avoid that. Let's see. Do you recommend Jade plasma with a triple combo procedure, or do you think extended tummy tuck BBL is enough? Well, if there are areas on your skin that needs to be tightened, like your back, I would definitely recommend the Jade plasma. If you're doing a tummy tuck, you probably don't need much of a Jade plasma on the tummy because the skin gets pretty tight. But if you are doing a combo and you have, let's say, like back rolls or areas of loose skin, maybe like in your thighs or in your neck or in your arms, then Jade plasma, it's amazing for that because it will tighten your skin another 30 to 40% on top of what the liposuction would tighten your surgery. So it's definitely recommended if you're doing things like that. Can I get a breast lift, tummy tuck, lipo 360 and full hips with 39 BMI? No, most likely not. So that is too high of a BMI to get any thorough tummy procedure. If you are below 40, healthy, you might be able to get liposuction and 3D lipo and BBL, but not much more than that. For tummy tucks, usually your BMI has to be kind of towards the 30 or below. Maybe 32, but maybe below. How long do you need to wait for to lift 50 pounds after extended tummy tuck? 50 pounds, I would probably wait about 2 months, 8 weeks. That would be reasonable. That's quite heavy. What helps to get rid of the scar tissue above the belly button and 4 weeks post-op? A lot of massaging, you know, it will really depend on how it looks. So if you had surgery with us, make sure you send us your info and then we'll guide you through the process to see how do you feel. If you feel like hardening or tissue there, you can always do massages, cavitation, and some other treatments that will help loosen up that fibrosis underneath. I'm not sure if it's visible or not, but just reach out to us and send us your pictures and we can guide you further. I have mastitis, not breastfeeding, currently going through it. I have to get it surgically removed. Will that affect my future breast lift? Yeah, if you have mastitis and you need surgery for that, you know, it will, yeah, it might affect it somehow, but we are not sure, you know, how. We're not sure what type of incisions are they going to use or how extensive the procedure will be. So it's impossible to give you an idea. I'm sure it's going to have some impact in the procedure that you're going to have in the future. So once you're all ready and healed after this, then just reach out and we can tell you our, you know, kind of opinion about what we can do and how things are now after that. Alberto Ortiz, ¿cómo estás? A ver, más. Doc, can you explain the exparel? We just did explain the exparel. Operas las bolsas de los ojos, una señora con diabetes. This is a question in Spanish. Sí, podemos operar, hacer cirugías de cara y cabeza y cuello, todo eso, si tu diabetes está bajo control. Así que nos puedes mandar tu información y te diremos si eres una buena candidata. How long after the procedure should you wait to schedule another one? Depending on where you're having the procedures. If you're having the procedures performed in the same surgical site, then you should wait at least 6 months, probably a year. But if you're having a procedure on a different surgical site, let's say your abdomen and now you're having your breast, then probably 3 months is more than enough once you're fully recovered from the previous one. Okay. Stanisha, let's see if she wants to talk. How much for a double chin surgery? Send us your information and we'll tell you everything. We'll send you, hey. Hi, Tanisha.
Hi,
How are you?
I'm fine.
Do you want to talk to me? Do you have any questions?
Your things are clean.
Doesn't seem that you need a tummy tuck.
Yeah.
What questions do you have? Because she's shy. She's too young to have plastic surgery. Okay, talking about that, what's the youngest that you can be to have plastic surgery? Well, really, in our practice, we only do adults, so you have to be 18 years or older. So if you are younger than 18, then you should probably wait. Which for most of the plastic surgeries that we do, you should wait anyway. Some of the plastic surgeries that we do in kids are, for example, the prominent ears. These ones, we can do it in adults, but we usually do it in kids before school age, so they don't get bullied. So that's one of the things, we can do. So for rhinoplasties, you should wait until you are like 17, 18 anyway.
I'm and then I still didn't get one.
Yeah. Ceci says that for her rhinoplasty, she's good with age. She's old enough. Is a tummy tuck always recommended after a BBL with Lipo 360? Not really. It depends if you need a tummy tuck. We will always give you the recommendation, but it's not always needed. Now, if you have a lot of excess skin, then sure. If you have your muscles are not so tight, sure. If your BMI is higher, let's say 35 or so, and then probably the first step is good to do liposuction and BBL, and then come back once you lose more weight, come back to get the tummy tuck. So that's a great way to stage things if you're, considering doing. Let's see, what else? I had surgery, Dr. Palladino. My stomach looks amazing. I'm getting another massage now, but I'll share next week. That's awesome. Well, if you guys want to jump in and show your results, it'll be awesome. Let's see, with a BBL, do you have to stay off your backside, or if so, when can you sit down? With your BBL, you should stay off your butt for three weeks. We'll give you a BBL pillow so you can sit on top of that, but you should minimize the pressure on your booty area. So 3 weeks is appropriate. After that, you can probably do whatever you want, because most likely you will not damage anything. Darlik, Honeys, hi, how are you? Good morning. It's here, it's afternoon. I'm not sure where you are. No tengo pompis, tomo medicamentos para la arritmia. No, if you have heart conditions, you should not. You're probably not going to be a candidate for plastic surgery. What kind of surgeries do you do? What kind of surgeries do I do? I do plastic surgeries. So, body, lipo, breast, tummy tucks, BBLs, all of that. But we also do some facial stuff. Today we did upper blepharoplasty, fat transfer to the face. Very interesting. we eyelid lift. That's called an upper blepharoplasty.
He does exceptional BBLs. He does triple BBLs, and he does rhinoplasties as well.
That's what you need.
But exactly, I have to just have the courage to do this. Guys, I want to just go over something very quick so we give the doctor a break because he's been talking nonstop, poor thing. We just want to say that we don't have the Cell Saver anymore. We have the Pro Care coverage, which this is an amazing package that includes blood transfusion, monitoring of the brain. If you have to have an reintervention, am I saying this right? Reintervention? Is that how you say it? Reintervention. Blood transfusion, a bunch of other stuff.
Yeah, the Pro Care package, we instituted that in changing for usually the Cell Saver that we used to do before. Now, the Pro Care package includes a lot more things. Many things are obviously in case of need, but some things are really cool. For example, the internal hemoglobin monitoring, so we can actually see your hemoglobin throughout the surgical case, and then in the hotel as well, we can check your hemoglobin to make sure that you don't need blood or you don't need. And if you do, then we'll give you the blood. And
you don't have to pay anything extra.
Right.
The same thing is like if you leave and you get some sort of like problems that you need antibiotics, and you need us to like write the prescriptions for you, or you need us to see you again. All of that it's like kind of like an insurance, which is really cool, and it covers a lot.
Life After Motherhood made a good question. She says, why did we take away the Cell Saver? We actually didn't take it away.
We didn't.
We
It's
made
the
it
same
better.
price, actually.
So the $500 you used to pay for the Cell Saver still, includes all this other stuff. So the Cell Saver is included in that one. Now remember
that and like 6 other items too. Like there
10,
is
like
an
9,
amazing video on YouTube. Please go to our YouTube channel, Top Aesthetics Official, which says Pro Care coverage. We did promote it in our feed as well. If you can't see it or you can't find it, we always do promote it. And so you can check all the things that the Pro Care coverage has, which is like really cool to know all of this if you're getting surgery with us. But before we continue, another little pause, scoot a little bit. I'm sorry, this is very important. My BBL is in danger here. As you can see, I really need a BBL, a serious one, more than any of you guys that are watching me. So if the first 10 patients or whoever's watching this is seeing us, we have the online store ready. So if you click in topaesthetics.com and you go to store at your right, there's a little link that says store. You click there. We have amazing things like, for example, this and this. This hoodie is really awesome. I love black. It's one of my favorite colors, although it's not considered a color, but I think this is amazing. Huh?
your hat. It's nice.
And it comes in white as well. Many of you guys like black. We have fajas, 2 garments, like a bunch of other things. So we encourage you to go there. They're great prices. We do delivery, so you don't have to worry to pick it up. And that's that.
Yeah. And then if you do 10 of those today, then she gets a free BBL.
I get a free BBL. You guys have to support.
She said-
Listen, scoot a little bit, please. Do you want me to keep walking through life like this? Just tell me.
Don't be bad, guys.
And
help
like
it out.
this, help me out. Rhinoplasty next. Let's go one by one. Let's not stress them out. I need a triple BBL. This is going to cost me too much. I need to get a discount. He's going to give it for free if you guys go to the online store. Each one of you buys one of these items. Enough said.
That's right. That's right. Help. Go fund Ceci. Go fund Ceci. Help her get her BBA today, tomorrow, maybe. Do you have your lab work done, Ceci?
I don't, but I can do it. I can get it done.
She'll do it tonight.
Exactly.
Yeah. Don't let her walk through life like that.
No,
So
listen,
they're
you want me to be
saying that
single forever?
here. Of course not, Ceci. How can you do if you're having a combination? How can you do that if you're having a combination? Do what? What kind of surgery? I say I'm 4, 5, feeling good. Where can I start working out? So 4.5 weeks post-op, feeling good. You can start doing stuff, but not go crazy. At a month, you're gonna feel good, but your tissues are still healing. So you don't wanna lift anything heavy, especially if you have like a tummy tuck. So my recommendation is if you have like something like muscle repairs or things like that, is that you give yourself a full 2 months to start lifting stuff. So wait a bit, you're doing good. Feeling good is good, but don't overdo it. This is the most common problem patients are having when they start feeling good 2-3 weeks out, and then one day they wake up and everything hurts, or they did something they shouldn't have done too early, and then there you go. So be patient. How many surgeries do I do per day? Just enough. It depends. It depends. We are very safe here, so it really depends on the type of surgeries that we're doing and so forth. So, but I'll tell you, I'm usually done with surgeries by 3 or 4. So the working hours that we have are extremely reasonable, and I'm trying to be as rested as possible for all my surgeries. So
okay, one more thing I didn't comment. These are people asking, and I'm jumping in. I'm sorry, I'm giving him a break.
sure.
This is very important, guys. Listen, we are one, if not only, and I promoted this today or yesterday, one of the only plastic surgery clinics in the US where you get out of here and instead of throwing you out like you're a piece of meat, and like a lot of plastic surgery clinics do, we book you, we put in a hotel, a premium stay package where you are in a hotel, monitored 24/7. He gets the vital signs of patient in his watch.
I'm getting
okay?
the vital signs of my
look at
patient.
this.
I'll see. I'm gonna try to
Oh
hide.
my God, it's saying that I should get a BBL.
Yeah, no BBL for you here. So I'm gonna show you, for example, here this is a patient. You can't see the name. I'm gonna show you the name, but this is today or yesterday actually. Post-op day 1. I'm gonna show you what I'm getting here.
It's coming out there.
So see, it's a little bit blurry, but you see the vital signs, the procedure the patient's having done, vital signs, procedures patients having done. So we can put it in all there.
Yeah.
So I'm getting all this information on all the patients that are at the hotel right now on my watch, and I keep track of these things, and I can look if something is not right and then call them or go see them if I have to. So these things, it's pretty amazing, and you will not see it anywhere. Find me another surgeon that get their vitals in their watch.
No, and another clinic that does this. Not only this, it's not that we throw you in the hotel and we're like, good luck, we'll see you when we have the post-op appointment. You get 3 massages, lymphatic massages that you do need. They are included in your package. Now, mind you, like if you go and purchase a lymphatic massage, any of you can Google this. It is very expensive. This is included in your package. A driver that he's like my mother, how he drives. Bless the Lord, okay? 20 miles an hour. He drives you to the hotel, to the clinic, back and forth. You don't have to worry about that. Calling an Uber, a taxi, stressing out. Then you have 30-hour recovery assistant. You have somebody there for you for anything that you need. I mean, this is all included in your package. We cannot stress enough to say that this is a complete package. You get everything when you get plastic surgery with us. Am I forgetting something else? You got a visit from the doctor too.
Yeah.
I mean, come on, you guys. Not even my ex did all of this.
I will see you. Yeah. I mean, for how much? Seriously. Like,
Okay, wait.
Yeah.
Wait, $1,500. That's all included. Now, you please do me the favor. Go and Google private driver, Google lymphatic massages, recovery assistant for 30 hours. Tell me how much is all that?
And a week of hotel with breakfast,
Oh, the breakfast included. I forgot.
doctor visitations
Yeah.
in your own room. Hell. And the doctor is getting your notifications in his iWatch.
Exactly.
Whoa. Seriously? Insane. Anyway, I think it's important to remind everybody, which sometimes we forget about these things that are extremely important, and we give it for granted because we created this super safe environment, but we forget that sometimes not everybody is like this. So it's important to do these reminders. What does fat transfer to the breast work? How does fat transfer to the breast work? Fat transfer to the breast works exactly the same as fat transfer to anywhere else. It gives you more volume. The thing is how much more volume you can get in the breast, usually not so much. It's not like the butt. The surface is a lot limited. So definitely not the same improvement that you can get in your butt as you will get in your breast. Also, another place that works really well, the fat transfer is to your face, because it will, for those patients that have a little bit of early signs of aging, it will really improve and plump up your face and make it look great. And if you like fillers, you're gonna love fat. John, hi brother, how you doing? What's up, dude? I don't know who you are, but good talking to you.
Does Morales have the same technology the rest?
All the surgeons that work at Top Aesthetics enjoy from the Top Aesthetics technology if you're a patient of Top Aesthetics. I can't really tell you about when you're having surgery outside Top Aesthetics, but this technology is available to all Top Aesthetics patients. All right. Do you prescribe gabapentin for muscle relaxer? I'm coming to you in September. So gabapentin and muscle relaxer. So we can, if we have to, muscle relaxer, yes, for depending on the procedure you're having done. Gabapentin is depending on the symptoms that you're having. It's not one of our routine medications, but muscle relaxers, yes, they are. What diet do you recommend after surgery? So I have a YouTube channel, a Magic Surgeon also that has a YouTube channel that has 3 videos about dieting. So watch them. High protein diet is always great after surgery because you will need a lot of protein to, heal.
What if you're a
So
vegetarian?
yes, you just do the veggies that have a lot of protein.
Okay.
No, actually you can do Boost, Ensure, one of those milkshakes that have extra protein, or you can use just protein powders, or anywhere you can get extra protein, then you should do that if you're a vegetarian. But yeah, increase your protein intake, or don't be a vegetarian. It's easier and more yummy. Gabapentin is mainly for neuropathy. Yes, we usually prescribe it for nerve pain. When you have sometimes a nerve irritation or nerve pain, or a lot of what we call paresthesia, so it's like that's some burning sensations, things like that, we can prescribe you gabapentin. How many cc's can be injected in each butt cheek, depending on the surface and depending how much fat you have. So I had injected 2,000 cc's per side on patients that are like large and they have enough fat. But not everybody it's able to get that. And depending, if you do a skinny BBL, you might inject very little and it's a lot.
Doctor, a question, but is Jade plasma 2,500 per area?
Is what?
Jade plasma 2,500 per
Oh,
area?
J plasma here, the way we charge for J plasma is we do just one fee of $2,500 and includes all the areas that we do liposuction. So if we do liposuction in your arms, your thighs, your neck, your body, then we will do liposuction everywhere for the same fee. We don't charge per area. I think it's a little bit easier, and thank you for your question. Yes. Is this Lucy Mornings? Is this a gynecologist? I'm not a gynecologist. I'm a plastic surgeon. So little different things that we do. When getting a breast implant or breast lift, no implants, what is the cut like? Small or the same cuts? Depending. So breast lift, either with or without implants, can be done the same way, and the incisions that you have depending on how much of a lift you need. So we can do a periareolar incision around your areola, or we can do an anchor incision. We occasionally could do just like a crescent incision just on the top of your nipple, but it depends a lot on what you need. So if you're putting implants and so forth. But yes, depending, we're happy to discuss your case in private. Yeah. Let's see. What's the period for working out in an extended tummy tuck? 2 months, 8 weeks, safe. So if you wait 2 months, you're gonna start doing stuff, and when you start progressively. Don't try to beat the world record on sit-ups, after the week 8. Do you get massages with extended tummy tucks? Yes. So all the procedures that we do here that require some sort of liposuction or even tummy tucks that we usually do liposuctions of the flanks, they all get massages. It's important. Let's see. I want to add a couple of procedures, but I'm already getting a triple combo. Do you suggest I wait? It depends a lot on what are those other procedures. So if you're adding just like lipo areas, then that should probably be okay. But if you're getting a triple combo, you probably are getting enough. And again, we do a lot of combination of procedures very efficiently and safely. But we will tell you, check with your coordinator. They always will reach out to us to give them the recommendation. So that will be a more, we can give you more an idea if it's okay and safe for us to do that in your case. When getting a BBL and Lipo 360, there's any skin removal. There is no skin removal in liposuction and Lipo 360. So if you have a lot of skin, you may need to come back for a tummy tuck or for excision of the skin, whatever you have it. So you will experience some contraction of the skin, and it's great, but it all depends on each patient. How many procedures can you get done in one surgery? Well, with us, you can get a lot of procedures done. Like you could get like your breast, your tummy, your booty. You could get, like your arms. You could add different things. So we normally limit these things to about 3 procedures, which is about 3 hours, which is, nice and safe and okay to recover from. And, and remember, you are doing surgery as an outpatient basis. You're not staying in a hospital, but you stay in the hotel under our supervision. So, let's see. Man, keep appearing in the questions. I can't keep up. I will be in Florida in 2 months. Can I go visit ya and say hi, Cici? Of course.
Gigi.
Yeah, Gigi can come and say hi to Cici and show off her results, of course.
Let me say hi to her.
Yes.
Hey Gigi, it's good to see you around. How are you? I don't know if I told you we have an online store. Look at this. Isn't this cool? Come on, you guys, go fund me. I need a BBL. I'm aggressive about it because it's not working, all the techniques I'm using. Listen, do you want to see me single forever or what?
Help Ceci get her BBL.
I'm gonna do a fan page of my BBL. If you guys can all help me, rhinoplasty next or vice versa. I'm not sure yet. My face, my back, something has to change here. Gigi, come over, come here.
Yeah.
We can even do a live with you. In the middle of the day or in the morning, whenever you're here, and you can show your results. We love to show the results to people so patients get a feel of how they might look if they get surgery with us and with Dr. Palladino or any of our doctors for that matter.
Yeah.
So just come and visit me. We'd love to have you.
She's offered you some fat.
Oh, you did? No, listen. People think I don't have fat. It's so funny that people think I don't have. Trust me, there is fat. And if not, they can take it out of my nose, okay?
Okay, can we do surgery on patients that have epilepsy? Yes, if your epilepsy is under control, usually that's not a contraindication. We may need the blessing from your neurologist, but yes, absolutely. Okay, so are you able to do a hernia repair? Yes, we are. A lot of times we do incidental findings of hernia repairs. Now, we're not talking about massive hernia repairs. We're talking about something that we incidentally find during surgery. Remember that I've done general surgery before. I first trained as a general surgeon, and now after that I did plastic surgery. So yes, I'm from Argentina. That's correcto. Buenos Aires. Can a person who weighs 118 pounds do a BBL? Well, it depends on how high you are. So that's why we always talk about BMI. 118 pounds sounds very little for somebody that is probably like 5'5" or higher. But if you are 4'11" and you're 118, maybe it's okay. So BMI is body mass index. Body mass index is a relationship between your height and your weight. That's why it's better to talk about BMI and not so much about weight, because we don't know how high you are. So, and also depends a lot about fat distribution, but, that's what you should think. When getting a BBL and Lipo 360, is the skin removal? No, we talk about that. There's no skin removal in those. My BP is 140/100 and higher. Is that okay for BBL and breast lift? No, that's not okay for a BBL and breast lift. That's not even okay for living. Like, you should not live with a blood pressure that high. And I tell you that you're not gonna live for too long. That's for sure. So you better get your blood pressure under control, because that's called uncontrolled blood pressure. That's uncontrolled high blood pressure, and that's not good for your heart. for your veins.
Okay, one
for
more
your
thing. Are
arteries.
you asking if we're booked up to May? Listen, the best thing you can do with the consultation, if you want to get booked right away, if you want to book soon, or whenever you want to book, send the free online consultation, because we do have rescheduling. We can fit you in sometimes. Sometimes patients move around. They book a date and then they move it and we have a slot. So don't worry about the date that you want to get operated. The only person that should be worried here is me, that I don't have a BBL yet.
Betty, what's the highest BMI or sentence that you can do? So we have also a BMI section on our website that will explain to you, depending on the procedure that you're having done. Like if you're having a BBL and lipo alone, that's definitely, you can get it all the way up to 39 probably if you're under 40, healthy, no medical problems, et cetera, et cetera. So, but then if you need like a BBL, then probably you need, if you need a tummy tuck, you probably need to be below 32. Just send your consultation and we'll tell you if you're a candidate for whatever procedure you want done, or we will recommend where. Gucci Val hi from El Paso. Hello everyone from El Paso, where I used to live for many, many years. Someone who has anxiety, can you all give medication to relax them? Well, we'll give you a lot of medication to relax you during surgery, so you don't have to be worried about that. But we don't give stuff before, because then the patients show up all loopy the day of surgery and they're passing out, and we don't want that. And sometimes we have to talk about, the serious stuff before surgery, so you don't want you all confused and all that. So that's why we don't give you a lot of medications right before. But if you take your medication, or if you take medications for anxiety, then fine, you can take it. What age is too old for surgery? It doesn't really matter your chronological age. It's more like how you feel and how your health is. So if you're healthy and you're, let's say, 65, you're probably a candidate for most surgeries. But you have to be healthy. If you're unhealthy with a blood pressure of 140 over 100 and you're like 37, you're probably not a candidate for any surgery. So I already had a consult. I want to add a procedure to book it. Yeah. Well, just check your coordinator. Tell your coordinator about that, and then she will reach out to me, and I will give you my recommendations.
Okay,
so
one
absolutely.
more thing on that. I'm sorry that I interrupt. This is a question that is recurring. I just want to make sure that everybody knows this. Let's say that you come here, and here's the thing. When you see the doctor in person and you haven't seen him before in a consultation, and you see him the day of the surgery for the first time, he's going to see you with these amazing eyes, and he's going to detect right away what needs to be fixed. Now, let's say that he touches you, sees, and said, look, I recommend in the surgery, you should add this or take this or put this. Then you can do the add-on right there. We can add it to your bill. The coordinator or the receptionist comes, adds that procedure extra, that you might as well do it since you're at it. So if you have any doubts, you send and you think you need something extra, or you want to ask him the day of the surgery, we do add at last moment some procedures.
So it's possible to do that. Now, it's rare that we have to do it because our plans are actually pretty good from the beginning. So, but occasionally we have to do some changes, and some patients want to, for example, add like an area of lipo of the arms or lipo of the thighs or things like that. That could definitely be added the day of their surgery. So it should be no problems. Usually it's not a big change in plans, but if you want to add something, it's possible. Do you recommend me to take out a IUD before? No, you can keep your IUD. You don't have to remove it. That's okay. Even those that have medication, it's fine. Do you have a payment plan or how it works? Yeah, so for those of you tuning in, we talked about financing before, but briefly, go to our website, go to the financing section. You're gonna find 2 different companies that we use for financing. You can do payments, you can pay your deposit of $500 and lock your price and your date for about a year. You have a full year to make your payments. Sometimes you can make payments and you can finance whatever you haven't paid so far using this method. So check that and talk. We have our coordinators that will guide you through that as well.
All these questions, many of the questions that you're asking, they're all in the YouTube channel. And not only one YouTube channel, 2 YouTube channels. Magic Surgeon, Top Aesthetics Official, age limitations, Pro Care Package, exchange of breast implants, BBLs, how do you sleep, positioning, when can you work out after surgery? All of those videos are there. And you know what's the cool part? They're only 2 minutes.
And we
Seriously.
have a frequently asked questions also on our website that will answer all of this. So if we didn't get to answer your questions, then
And here I want to show you the online amazing store. GoFundMe for my BBL. I don't know how to say this more times. I love you all. I deserve it. We have an online store, t-shirts, hoodies. Let me show you
if we
this.
get 10 products before the end of the live, Ceci gets a BBL for free.
That would be pretty
That's
cool. I
quite
think I
an
deserve it by
undertaking.
now. I'm a good gal. Listen, you guys want me to be single forever? Look at this. Look at this hoodie, how amazing it is. And we have the hat that I'm not wearing, this mug. There's like fajas. There's a bunch of other stuff.
Yeah, it's cool
And
stuff.
just log in topaesthetics.com. You go to store in the corner. You click in there. And all the online store comes up. And we have like quick shipping too, so you don't have to worry about that. Or if you want to purchase it when you're here, the day of your surgery, you give me a testimonial. You get a couple of little things. That's a little secret there. Please don't share that with everybody. Just give me the testimonial. The interview in the morning after your surgery will get you going. And that's that, you guys. It's a really good deal, all of it.
Ceci will keep you awake in the morning, for sure.
For sure.
Yeah. You can see sometimes our patients' testimonials in the morning. They're like shy. They don't want to talk too much. And then after they start talking to Ceci, they're very chatty. Can you do lower back lift with a BBL? I am not sure which would be best. Well, we will need to see. Sometimes you might be referring to like a lower body lift or something like that. It's definitely something that we usually combine with BBL. So the answer is most likely yes. So we will have to see your case in order to recommend further. But send us your pictures and your information, and we'll do a free consultation and tell you what it's. I lost 80 pounds and have loose skin. I'm 54, diabetic, under control. So if you're a diabetic under control, then it's just like a normal person. 54 and no other medical problems, maybe you are be a candidate. So sometimes in patients that are over 50 and we have to do this, we do it in stages. We first do something, we are very safe. So sometimes we do like circumferential body lift, tummy tuck, things like that, and then we come back and do the breast or so forth. So absolutely possible. Just send us your information and we're happy to take it.
This is how cool we are. This is like a mini Palladino. Look at this.
Well,
Look at this.
I'm
This
gonna
is
tell you,
Julie. Julie, if you're watching us,
Yeah.
if you ever see this live, because we do post it online, look how amazing what she got us with an amazing card. She all made us cry. It was
Yes.
amazing. And then another patient brought this for him too as well.
These are all so cool
These
gifts
are
from
really,
our
but I mean,
amazing
look at
patients.
this,
Look
and
at
he
that.
moves. It's like amazing. Like we love it. You know, it's really cool that the patients do this. We're really grateful to have you all
Yeah.
and to choose us. So remember that all the questions, every doubt you have, you can always DM us, and we are there to respond. Sometimes if you ask very medical, technical questions, what I do is I ask the doctors, they respond, and I respond to you. Just give me a chance, but I'm always on it. We're always working on it. Any questions, doubt prior to your surgery, whatever it is that you're doubting about, you go to our YouTube channel, Magic Surgeon or Top Aesthetics Official. Everything is there. We have Twitter, we have TikTok, we have Snapchat. All of our social media is out there. And there's a lot of information there that you can check.
Awesome. So here it says, which faja do you recommend for ETT and should I have before the procedure? So so we will provide you actually all the accessories you need for your surgery, so you don't have to even worry about that. So we will provide you with that. If you do the premium state package, we'll provide you with the care, the massages, the hotel nights, and just bring a companion, 18 years or older. So it's 6 o'clock. Actually, a little bit over 6 o'clock. So we've been talking for an hour now. So let's answer a couple more questions and then we'll be done. How strict are the BMI requirements? If I see clearance request about 31.9, most procedures if you are below. So it's important, depends. We will set a BMI requirement just for you when we do our consultation. So we are strict about that BMI requirement, but in general aspects, there could be some variation. So send your info and then we'll tell you where we want you to be for your particular procedure in your particular case. So that's a good question and allows us to answer that.
Okay, let me say bye to everybody.
Question again.
Guys, listen, so remember, if you give me a testimonial in the morning and then you give me another one after your surgery, you don't even have to move. I come to your room and you give me a sweet testimonial. There's a little mystery for you there because we're so grateful that you talk to me at 6 a.m. in the morning, even if you're so asleep and you're about to get surgery. I do all my miracle powers of a girl that needs a BBL, and is working very hard for it. So I shall see you whenever you come to surgery, you know, as soon as you walk in.
Okay, so we are wrapping up. If you want to visit our online store, visit topaesthetics.com and you'll see the little store in the menu there. So you go to the store there and then you'll get to the store. We do use high profile silicone implants. We do moderate profile, high profile, extra high profile. We have all the choices that you will need. Absolutely. So thank you so much everyone for tuning in. We will do it again. If we didn't get to answer your question, just DM us. We will answer, and don't forget to check our YouTube channel, our frequently asked questions section on our website, and just DM us and then we'll be happy to answer you directly. So have everyone a great night. I will see you soon again. Adios. Adios, adios.